Making Council, and the second question is digital safety. Sorry, I'm just seeing if I can mute that coming through. I'm not sure if you can hear that on my computer, apologies. So far I can see that 56 of you have answered the first question, and that's about the National Digital Shared Decision Making Council. So it's really positive to hear that some of you have heard of the council, but let's start with an introduction for those that haven't. In 2020, during the COVID pandemic, the Chief Nurse of England, Ruth May, established the first National Shared Decision Making Council, and the aim was clear. It was to involve point of care nurses and midwives, both student and qualified, to come together to collaborate through collective leadership to discuss key issues, concerns, and bring in the great work that they are doing personally and locally to the table. And that's where the Digital Council was born. The National Digital Shared Decision Making Council is reaching its third year, and the current membership is with 31 brilliant members. We meet monthly discussing a range of agenda items and topics. The council members span across England, and we're embedded into the regional digital shared decision making councils also, and we sit on national board, and that helps us bring the messages back from the front line up to the to local, regional and back to board to ensure that our nurses are heard. The overarching aim of the council is to ensure that every nurse and midwife has the confidence, knowledge and skills to lead safe, effective, technology-enabled care. By doing so, we can help influence, build or advise national and local policy relating to healthcare that's enabled through digital technology. Since the launch of What Good Looks Like for Nurses, the council have been feeding this into their monthly agendas, and we hope through the masterclass that we can share some of our learnings and findings. Next slide, please. So over the next hour, we're going to hear from the council members taking us through the 7 success measures. And towards the end, we have 2 of our other council members, George and Hannah, who bring 2 different insights for you to hear. Next slide, please. So firstly, just a welcome to the session for those that have joined. My name is Emma Arrowsmith, and I am the current chair of the National Digital Shared Decision Making Council. As I've mentioned earlier, I am the chair of the council, but my day-to-day job is a digital matron for County Durham and Darlington Foundation Trust up in the northeast of England, where I lead a wonderful digital health team. Amongst the 31 members of the council, we have members who are at university, work for NHS organisations, ICSs and private companies who thread digital throughout the work that they do. Each member represents digital nursing leadership, regardless of our role or job title, as we drive forward the clear ambition of safe, effective care through digital technology. The work that we do at the council helps support our nursing and midwifery colleagues on the ground in their own organisations, but also in the wider healthcare community. We range from digital nurses, matrons, students and chief nursing information officers across each region in England, driving the digital agenda through the good work that we do. As new policy or legislation flows from the board, the council have the ability to bring it through, to understand their needs and apply it to the nurses on the ground doing the do. During our council meetings, we hear about current projects, problems or ideas where we can collaborate and feedback together. The work we do here is summarised and it's available to be fed back to national boards, for example, ensuring nurses are supported and heard. We are just in the process of finalising our council newsletter, which will help us further in our mission to support the nurses and midwives across England. At the council, we heavily integrate shared decision making, and one way that we do this is through the development and implementation of blueprinting. The future NHS platform hosts blueprints, and they are designed to be a step-by-step guide for NHS organisations to carry out digital transformation quickly and more effectively than in the past. The council have been involved in the design and development of published blueprints for projects they are involved with in their own organisations. By using the collective leadership of the council, we are able to share projects, ideas, or generate solutions to ongoing issues. I'm going to talk to you about a problem that I had within my local organisation and how we fed it through the council and got a blueprint done. So in January of this year, I presented an organisational problem that we were facing with a potential digital solution to the council. The council were able to generate a discussion, ideas, and we worked together to refine a process to ensure that we had digitally enabled joined up care. This work was a time-critical project, and the project resulted in a digital solution. It was reviewed at National Board and it was developed into a blueprint at pace. But when I joined the council, I listened to the members who had produced a blueprint and the work that they were doing, and I didn't actually think that I would be able to produce one. The project that I was doing for my local organisation was linked to a risk assessment. And it was a risk assessment that would help us identify the safest patient to be boarded into a corridor to be nursed, which is obviously something that none of us as nurses want to be doing. The risk assessment had been developed into a blueprint, and it can be found on the Futures platform, which helps spread the good practice and share good ideas with the end goal of supporting nurses. For those who are listening today, I want you to consider, are you a nurse or midwife on the ground doing the work, perhaps involved with those projects or finding the solution for your own organisation? If that's you, then please consider sharing the good work that you are doing by developing a blueprint and help support your nurses and midwives across England. There's information on how to do this on the blueprinting page, and there are some templates for you to look at. But if you would like to discuss it with any of us at the council or myself as a nurse, then I'll be happy to hear from you and I can help try and support you in developing your own blueprint. If you are interested, the council are driven to support nurses and promoting that digital thread throughout healthcare. And if you think that you could be a member of our council and help us spread that, then please consider joining either a national or a regional council that we will discuss further in this presentation. At the very end of the presentation, you will be able to see a link tree with all of our contact details on. So if you would like to contact us or hear more, then please have a look on the link tree and you can contact any one of us from the council. So thank you for listening to my slide. I'm now going to hand you over to Sophie.
Amazing. Hi everyone, and thank you, Emma. You've really done a fantastic job at chairing our council. So as a further introduction, my name is Sophie. I sit on the National Shared Decision Making Council and also a local lead for our London region. I'm a midwife by background and a master's student in digital health. I'm also an NHS clinical entrepreneur, which is a national innovation fellowship, and the co-founder of Lister, which aims to replace the unsafe and inefficient paper handover sheets or paper job lists that still seem to saturate our NHS, regardless of digital transformation. I'm also an Innovation Fellow at Mid and South Essex, and yesterday I completed the new Innovation Placement Leadership module, which was sponsored by Health Education England, and I actually mentioned the What Good Looks Like framework during my presentation for sharing a promised land for digital transformation. So I'm going to be talking about smart foundations, and smart foundations support nurses by providing them with the right tech infrastructure, ensuring environments are reliable, modern, secure, sustainable and resilient. I support this within my role as an innovator by acting with accountability, adhering to clinical safety standards, and have built my product with a co-design approach to ensure it is reliable and appropriate for the fast-paced clinical environment. I'm currently testing and evaluating my innovation, starting small by pilot sites on single wards, with extensive stakeholder engagement and data sharing agreements to ensure this is executed safely. As well, I'm currently integrating with one of our trust sites because we know that is important for workflow and reducing duplication, and I look forward to sharing and learning with my council members. The council also promotes knowledge sharing on safe digital standards, and you will hear more about this in the following slides. But many of our council members are CSO trained, with some becoming CSO trained during their time on the council. We also support nurses in clinical practice by sharing experiences of EPR optimization, creating fit-for-purpose solutions, and highlighting digital skills and leadership with the promotion of how technology can lead to safer care. Thank you all for listening, and I'm now going to hand over to Kimberly.
Hello, and thank you, Sophie, for that slide. So hello, my name is Kimberly. I'm a digital specialist nurse and deputy clinical safety officer at Bedfordshire. I've been in this dual role for nearly a year now. I also chair the East of England Regional Digital Council too. It's good to see from the poll that was set up at the beginning of this session that quite a lot of you know what digital clinical safety is. And hopefully this slide will give a bit more insight to those who do not know or are unsure of what it involves. So within my job role, the aim is to work together with clinical staff and staff within IT. Along with this also comes working with suppliers. These suppliers who are wanting to do business with the trust to bring their technology into our hospital to start a process of easier workflows for clinicians. This starts in the form of something called a DTAC, or in longhand, a digital technology assessment criteria. This is designed to be used by the trust at point of procurement or due diligence process to make sure the technology meets NHS England's baseline standards. By having a DTAC in place, it can assist the trust to realise the benefits of technology. This needs to be completed for all new digital technology. The DTAC criteria is linked closely to the DCB 0129 and DCB 0160. These two safety reports are in place to check that the product does not cause harm to a patient. Both are mandatory under the Health and Care Social Act of 2012. The DCB 0129 is the manufacturer's safety case report, who carries out a risk assessment on their own product and document the findings from that. This is a report that states what their product does, the requirements it needs, if adaptations can be made to it, the testing they have undertaken and any hazards they have collated. Once this document has been sent to the trust, we can then start work to complete the DCB 0160, where then the trust assesses the document from the supplier. They complete their own tests in the form of user acceptance testing, which can be clinical people who will be using that system, along with professional testing, which is done at Bedfordshire by our testing team. We then review the hazard log given to us, and we build that into a workshop with clinicians and IT to how these would affect the trust if the product was to go live, and then document these findings. Throughout all these phases, it is critical to have input with all teams implementing and working on these projects. The list is not exhaustive, but having input with your project managers will give you greater insight to the teams and what the overall achievement is for the product. From this work, the National Digital Council have an assisting part called a digital minute. During this digital minute, each person states what they have been recently working on, and this assists with building up relationships with other hospitals and the projects they are working on, and to be able to link in with other clinical safety officers if working on the same or similar projects. Also included on this slide, there is a link to ELFH. This course gives a brief introduction to digital clinical safety, which is approximately 30 minutes long, but will give you a foundation on which to build knowledge. Thank you for listening. Next is my colleague, Johanna.
Thanks, Kimberly. So, hi everyone, my name's Johanna Kelly and I am the CNIO at Maidstone and Tunbridge Wells Acute Trust, and I'm here to discuss the success measure support nurses and how this aptly reflects the work we do at the council. Many nurses, midwives and AHPs fall into the wonderful world of digital by chance, through a patient safety concern, a national mandate, or maybe you just showed a slight interest while helping your chief nurse join a Teams webinar. But ultimately, we all share a love of quality improvement, a drive to challenge the normal, and to see the overwhelming benefits to digitalising the NHS. These roles can be incredibly isolating. People no longer view you as that traditional nurse or midwife, and you have to learn a brand new language, often leaving you doubting your identity or purpose. Imposter syndrome is a strong force to tackle, especially on your own. So I recommend building an army. This may be through ensuring you have a dedicated digital team as your colleagues, or reaching out to like-minded individuals, creating your own community of practice. Use the digital networks, digital health networks, NHS Futures, Faculty of Clinical Informatics, to name but a few, to share or steal ideas. For me, I can honestly say that the shared digital national the National Digital Making Council is my army. It helped me get the role of the CNIO I am in today, and demonstrates how much they represent the support nurses success measure. Suddenly I had a voice. that was valued and contributed to national changes that I really cared about. It's when I knew I wanted to create a career for myself in digital, but also establish a pathway for those aspiring nurses and midwives so they don't have to leave it to chance. Seeking opportunities to enforce our position through education and gain the recognition that we deserve. This may be local development, leadership courses, or national programmes like the Florence Nightingale, NHS Digital Academy, or Digital Health London Pioneer Fellowship, again, to name but a few. So promote your digital workforce at every chance you get. Not only will this help clinical engagement with your non-digital colleagues, bringing them on board to new implementations, but it will also give them a route to highlight innovation, new ideas that might just be the next digital game changer for the NHS. And if you don't yet have a digital team, reach out to your CCIO, chief nurse, to find out if this is on the agenda and how you can be involved. Our nurses, midwives and AHPs are experts in their fields, but with the introduction of digital technology, some might find that they are suddenly novices, struggling to adapt to this new way of working. Some fearful of making mistakes or just not willing to change. As leaders, it's our responsibility to ensure that no one is left behind. Building a community of digital ambassadors within your trust to support or signposting your staff for further education and identifying individual literacy needs. There's some fantastic tools out there to guide this, including the HEE Digital Self-Assessment Tool or the brilliant All-Ireland Nursing and Midwifery Digital Capability Framework. You can use these, adapt locally to your trust's own needs, ensuring that your own colleagues' needs are met. Once you've identified the gaps, it's easier to fill them, and your colleagues will feel more invested in the digital changes and begin to understand the benefits. Let's not leave the pathway for our future digital innovators to chance. Let's ensure they are given the opportunities to develop in the areas they're passionate about, drive change and acquire skills to progress their careers, and help get all our nurses, midwives and AHPs ready for this digital transformation. Thank you, and I'm going to hand over to Victoria.
Thank you so much, Johanna. Good afternoon all, my name is Victoria Mustafa and I'm a Maternity ICS Programme Manager and Digital Midwife, and I'm going to talk to you about the success measure Empowering People. Nurses, midwives and allied healthcare professionals all have an active role to play to ensure accessibility and digital inclusion is embedded throughout our daily care journeys. We as healthcare professionals also have a role to empower one another. Did you know that 11.9 million people, that's 22% of the population, do not have the digital skills needed for everyday life in the UK? By 2030, it is predicted that 4.5 million people, that's 8% of the population, will remain digitally disengaged, and that people with a disability are 35% less likely to have essential digital skills for life. I wanted to go over a good example of learning from experience, and there is a point to this, so please stick with it. The maternity unit you work in is updating its maternity information system, which we call a MIS for short, to a system that is paper light, meaning that 95% of its documentation is online, including the woman's digital care record. This was to ensure it met NHS digital standards to support maternity services and offer women and birthing people digital versions of their care record by replacing traditional paper records. The MIS is rolled out and traditional paper records are replaced with online digital care records. Throughout this transition, no patient public involvement and engagement was carried out, and wider stakeholders such as GPs were not actively included in this process. Having an almost fully digitised system was a great step in the right direction, however, it raised a few unexpected issues. GPs were no longer able to access the previously used paper records, meaning that those GPs who were providing shared care were no longer able to see the woman and birthing person's history and ongoing care. This provided a huge risk, and GPs soon stopped providing shared care. Unconscious digital exclusion was introduced. Not all service users were able to connect to the internet and go online and access their maternity record. It was also noted that not all staff members had the skills and knowledge to show service users how to access their digital maternity record, which meant that service users lost faith in some of the areas of their care. Had service users and key stakeholders been engaged in this process from the start, these issues may not have occurred. However, with digital solutions, we will always come across barriers and issues. It's how we deal with these issues that matters going forward. So what does good look like to help empower people? Assessments to measure people's digital literacy should be incorporated into nursing care, ensuring identification and support for those at risk of digital exclusion. Staff should undergo regular digital literacy assessments, and ongoing training and upskilling should be provided in their place of work. Citizens should be encouraged to take part in their care using available digital technologies, and staff should also be aware of how these technologies work. Nurses use new and existing systems such as patient participation groups, where citizen voices are heard and their findings are shared, to design digitally enabled care which reduces disparity of services. Citizens are identified and encouraged by nurses to take part in service design, providing information to patient groups and user design forums. The key message is that we need to involve our staff and citizens and not just engage with them. Being a member of the Digital Shared Decision Making Council gave me the experience of how other trusts and professionals work. I was able to link maternity with nursing. I soon realised we all had things in common, such as digital inclusion and exclusion. It was helpful to work together to try and tackle areas of needs, especially as the pandemic hit. Stepping out of a trust role and into an ICS role allowed me to bring this experience to the group and take key learnings from the group back into the ICS. Upon reflection, citizen and staff digital literacy were no longer on my radar, and so the introduction of the What Good Looks Like framework was welcomed and has helped me to know where to focus both across the ICS and through the trusts that we work with. Thank you for listening, and I'm now going to hand over to Kumbi.
Thank you, Victoria. And my name is Kumbisa. I'm an Equality and Inclusion Project Lead at Birmingham Community Healthcare Trust, and I'm looking at how we improve our care. In Birmingham 2 years ago, I set off with the task of looking at the early identification of pressure ulcers in darker skin tone. And this was following a call from Professor Bennett in 1995. Where he said globally we didn't have the right solution when we were looking at darker skin tone in relation to pressure ulcer care. So we looked at how we could look at digital solutions that would enable us to enhance this. So we looked at bringing in a photo app, and we also looked at bringing in the SEM scanner. So that's a subepidermal moisture scanner. I guess the question is, why do you bring in technology? I think we're looking at digital health and we're looking at the way we go forwards. And I think this is the way that we need to take things forward, is how do you step out of the box and how do you bring in things that are different and things that bring change and purposeful change to our patients. So what we found in bringing in digital solutions was that it enhanced our communication. So we're able to send instant referrals now to professionals within our patch when working on complex care. We can request second opinions, so we're no longer working in isolation, this being from our GPs through to our multidisciplinary teams. And it's also added another perspective to our written records. So whenever we're presenting at our SI panels and coroner's court, what we now have is more information that we can provide on how our care has been delivered. In terms of improved efficiency, what we're looking to do is build an image library. I think what we found is that we haven't got anything that's centrally located that's easy to access. We're looking at virtual consultations. So can we treat patients within their own homes? Can we avoid travel for both patients and staff? We're also looking to look at how we automate and schedule care. So if someone has a pressure ulcer, can you send them routine links that enable them to take photos regularly, and you can monitor them on a weekly or monthly basis depending on the need of the care. It's also allowed us to increase our patient engagement. So the photos that are taken, they can be taken at a convenient time for the patient. Sometimes we find within our care provision, we tend to tailor we tend to say to the patients the care should be tailored to how we're working, but actually digital health will allow us to allow the patients to tailor it to their needs. Patients can monitor their own progress. I think what we tend to find is that patients rely on us to monitor their care. And actually, how do we change to ensure that patients have more autonomy, which leads to more patient concordance? And early discharge. We're also working on the early discharge of low-risk patients through our photo app, which means that we can focus more on high risk and complex patients. And what we're hoping in the end, that will lead to something like the NHS app, where you can actually see all your medical information and you can articulate the needs of your care. In terms of better data management, we were able to identify when we're looking at darker pressure ulcers and darker skin tone, that these were identified quite late on in the care. And so through the app, what we're hoping to do is to look at the early identification, early monitoring and early management of pressure ulcers. We also were able to understand that our staff were actually not confident in what to look out for when looking at darker skin tone. And so what this has resulted in is training. So we've changed our training to reflect that there's now darker skin tone. We've changed our risk assessments and we've changed our initial assessments. It also allowed us to look at our clinical and information governance. And what we've now done is we've now enhanced our consent and our DPI processes, because these weren't reflective in the care that we wanted to deliver. In terms of improved collaboration, what we've done is we've brought in teams within our organization to work more closely. So for example, our tissue viability team now works more closely with our district nursing team, podiatry, lymphedema, amongst other services. It also started to allow us to look nationally. So we have been working with the Royal Brompton, Liverpool University Foundation Trust, West Lothian, Glasgow, and the Scottish Tissue Viability team, where we're sharing our care. And more recently, the West Midlands Community Digital Group, through the NHS England, where we're looking to see how we can scale up this type of digital care. In terms of improved clinical knowledge, I think what it did, it allowed our staff to have a safe space where they could talk about where they needed to have additional knowledge and training. So for example, there was a national campaign called React to Red. A number of staff will look for redness or blanching. However, if you look at me, you'll never see redness on my skin tone. So how does this improve care? I guess digital health has allowed us to start to look at the data that can evidence how we need to change care. And lastly, what it did, it showed a good impact in how we could demonstrate the need for funding and finance. Normally, when you talk about digital health, finance tend to say it's too expensive. When we're looking at the SEM scanner, we piloted this for 4 weeks. And in 4 weeks, we had 0 pressure ulcers on a 15-bed palliative end-of-life care ward. When we took this to finance over a 12-month period, what this could mean was potentially £100,000 saving just on that ward. So again, there is that take and saying, if we need to improve care, how are we looking at it holistically? So I will leave you with this. Maya Angelou said, "We do the best with the knowledge that we have. However, when we know better, we must do better." I will now hand you over to Steph.
Thank you for that. Sorry, I was a bit coming off. Good afternoon, everybody. My name's Stephanie Zach. I'm a Queen's nurse. I am the Digital Champion Project Lead for Lancashire and South Cumbria, and also work as in primary care as a practice nurse. I've been on the Digital Shared Decision Making Council since this started, and I'm currently a co-chair of the North West Regional Digital Shared Decision Making Council. Today I'm going to discuss population health. So population health management is often touted as an important concept for the NHS and the key to ensuring sustainability. As we strive for sustainability, and technology just gallops on, and there's been outpouring of new digital solutions designed to alleviate pressures on healthcare staff and on the healthcare system. Most fall into either categories of automating processes or that empowering patients to take better care of their own health. So what does good look like? It's widely accepted that there is a need that the current healthcare system to place more emphasis on illness prevention rather than treatment, not least by using data to identify potential beneficiaries of proactive intervention. The key thing for us is to make sure that we are looking at a whole population, those people who are well, and equally those people and groups who are perhaps susceptible to certain types of disease and who we're managing at home. What good looks like? How can we support patients to become more active participants in their care? Each member of the council offers experience, innovation, bringing together a diverse range of roles and point of care across the regions. Population health is everybody's business. So how can population health inform nursing care and nursing practice? How can the Digital Shared Decision Making Council contribute to a smarter data collection to help us learn more about population health inequalities and create a more equitable service? The council members work hard to implement digital technologies and solutions to identify and address factors to reduce inequalities in health, some of which my colleagues have already mentioned. The rise of remote monitoring and telehealth means it's increasingly possible to care for people at a distance. Not only does this ease the pressure on overcrowded hospitals, but it also empowers patients to be in control of their own care and those decisions involving their care. Many argue that population health management could help to identify those who are best cared at home before they actually end up in hospital beds. Advances in technology mean people can treat themselves at home, don't need to have a consultant sitting over them. During the pandemic, digital technologies enabled care delivery through video group consultations, remote consultations, contact tracing, and many, many more. The use of apps to help patients manage their own conditions was massive during COVID. Advocating a radical upgrade in prevention and public health based on new partnerships with local communities and local authorities to provide patients with greater control of their own health, supported by a breakdown of traditional barriers across the provision of care. Action to prevent the occurrence of ill health, finding ways of sharing innovations and health promotion, empowering patients, informing colleagues on best practice is key to the success of the Digital Shared Decision Making Council. The commitment and collective leadership within the council as joined up care reflects the need to get serious about prevention and to harness new technologies which transform our ability to predict and diagnose disease. To deliver its potential, national and regional digital health initiatives must be guided by a robust strategy that integrates financial, organisational, human and technological resource. We have the privilege of working alongside national figures like Helen Crowther, who is the council's conduit to key policy and decision makers. The future of health is digital. The Digital Shared Decision Making Council are a big part of that. Thank you for listening to me, and I now would like to hand you over to our colleague George. Thank you very much, everybody.
Thank you, Steph. Hello everyone, my name's George Madden. I'm a final year Masters Nursing student at the University of Derby. I'm here to talk to you today about my perspectives as a student nurse on the What Good Looks Like framework in relation to the work the National Digital Shared Decision Making Council does. I was first introduced to the council as I was interested in digital nursing and what that meant for my future practice as a nurse. As part of the council, I've been made to feel like a valued member of the team, being supported throughout by its members. I've witnessed how the council has provided a safe space for its members to communicate their ideas and discuss solutions, providing space for innovations which I know have already been put into practice, enabling the building of smart foundations, ensuring safe practice and improving care while supporting its members, as well as providing a place to share and celebrate successes. It has supported me to become more digitally literate, helping me digitise my own practice, as well as enabling me to support others to do the same. It has already empowered me to identify digital solutions on placement and present this to my ward leaders in hopes to better support patients and staff to improve care, making use of digital technology that they already had but didn't know they had access to. An example of this was implementing implementation of a digital fluid balance on a surgical ward, using evidence from the Trust's own service improvement department and my own research. I showed that digital fluid balance improved patient outcome and reduced errors in documentation, hopefully encouraging them to implement this digital solution. It has also provided me with opportunities as a student that I would never have expected, such as producing a review for the council, speaking to very senior nurse leadership, being invited to events and conferences, and presenting on platforms such as this. I think the council really offers a fantastic opportunity and would encourage people to get involved and join their own national and regional councils as well. Thank you for listening, and now for Hannah's video.
Hi there, my name is Hannah Jackson. I work at Nottinghamshire Healthcare NHS Foundation Trust as Quality Improvement Lead. I'm a nurse and I'm passionate about innovative clinical digital practice. Unfortunately, I can't be with you today in person, so have pre-recorded this to speak about how we achieve ward to board leadership and how this fits in with the Digital Shared Professional Decision Making Council. You will have already heard from my colleagues about how we are contributing to the What Good Looks Like framework for nurses. So for this slide, I'm going to speak about how we take this to an influence at board level. I'm a member of this National Shared Professional Decision Making Council, and I also represent the council at the Digital Nursing Programme Board. For those who are less familiar with this programme board, it is chaired by our Chief Nursing Information Officer and is a board which discusses the implementation of and progress of the What Good Looks Like framework. Broadly speaking, structured around the 4 pillars of leadership, research, education and practice. So as a member of this council, my role is to attend this board to ensure that the voice of the council is represented. The aim of this is to achieve true wall-to-wall communication and one professional collective voice. This is an important opportunity to ensure that the voice of point of care nursing teams are represented at the board. Recently, there have been a number of regional decision-making councils which have been set up. This is really, really wonderful because it enables us to share and disseminate good practice and network with other nurses and midwives who share a passion for safe, effective, digital, innovative clinical care. From the diagram, you'll see this also provides a communication channel through the councils and up to the programme board. From local shared decision-making councils in organisations, to regional councils, to our national council, and then finally to the digital programme board. This enables leadership at every level, providing a structure to influence decisions and positively contribute. But as importantly, it also provides a mechanism for the reverse, sharing decisions and discussions which have been had at the programme board, which can be taken back to the councils for further discussion and then fed back up to the board. Our aim is to drive forward with digital transformation, cutting through organisational boundaries and barriers to overcome variations in practice. Our voice, the voice of nurses and midwives, to be heard and to be part of this decision making. So is your council, is your organisation represented at your regional council? If not, could it be you who provides that voice and representation? If you're sat there unsure as to whether you have a regional council in your area, that's okay. We'll be sharing the names of the regional councils after this presentation and again in our newsletter. The role of the council is to ensure that every nurse and midwife can be heard and have access to the programme board via the councils. We know of the talent and the expertise of our colleagues working at the point of care, digitally innovating, and as council members, it's our responsibility to ensure that our colleagues are represented. Thank you very, very much for your time. I'll leave you finally with our challenge to you. How are you generating a rich and vibrant discussion about what good looks like for nursing and midwifery within your own organisations from ward up to board? Thank you.
So thank you. You've now heard from our 7 success measures and then from George and Hannah at the end. We've been watching your questions as they come through, but just to say what's on your screen at the moment is our QR code to our link tree. So that's got all of our council members on. So if you did have something specific that you would like to ask one of us, you can find our details there. But we're hoping that you've popped it in the question and answer. So we're just going to have a look through now. I'm just going to pop to the bottom. We'll start with, there was a couple of questions about how can I get involved with the Digital Shared Decision Making Council, or how can I get nurses and midwives in my area to get involved? So as we've already mentioned, we sit on the National Council, and then we also represent on regional councils as well. So if you head to the NHS Futures page, you'll be able to find all of the regional councils, but also the regional leads. And when we publish our newsletter shortly, you'll be able to see who's matched up with which council. But expressions of interest come out for all of those councils, and we're just about to refresh our national council. So please do look out for an expression of interest to be able to join the national council. From there, you'll be able to see the regional leads. Helen Krauser supports us from a national council, so please feel free to speak to Helen directly, or you are welcome to email any one of us on the council if you would like to be involved with digital, national council or regional. The next two questions are around blueprinting. So can we use a project that we've done as a nurse to make into a blueprint? And I think there was a question just slightly up about blueprints as well. How do I submit a project done to be included as a blueprint? So the blueprint inside of it sits with the NHS Futures platform. So if you head there, there's a blueprinting section. And when you're on the landing page for blueprinting, there is a section called guidance. In there, you'll be able to see the template for the blueprint. If you just simply follow that document, it asks you some general questions. The one I did was time critical, and we did manage to do it within a couple of days. So if this is a project that you've done and you want to share with everyone, then it shouldn't take too much time to do. If you want any advice or help with that, I'm happy to support, but there is lots of guidance on the webpage itself. The next question we can see is what is out there to support aspiring digital nurses? And I think, Jo, that would be a good one for you to answer if you don't mind.
Do not mind. Hello. Off the back of the blueprinting as well, Emma, I found it really useful as a CNIO to be able to go and actually see what other trusts have done as well. It is a fantastic platform, so really do use it if you've got a project coming up, just to see how other people have done it. Normally quicker and better, but it's good to find the information out. So I have another question as well on there about sort of digital nurse support networks. So I have just added some of the networks, unfortunately not like a link because I couldn't copy and paste, but I have added on there some of the main resources that are available. So there's the digital health networks, there's the Futures that Emma was just talking about, where it's a brilliant platform with loads of information and lots of different things that you can sign up that you're interested in. So if you've got an interest in AI or you have an interest in data, making data count is really interesting platform to get involved in. So there's loads of different things that you may have a slight interest in certain areas. I would say one of the other best ways to improve sort of your awareness about things and is to get out there and to network with others. So something like Rewired that's coming up very soon would be a really good place to sort of network and meet other people that are like-minded, that you can have the right conversations with and find out how others have got into health, digital health. I very accidentally fell into digital health, and I think I probably speak on behalf of a lot of my colleagues that it comes up because you're interested, you fall into a project that then takes it on this digital journey that you've really enjoyed, and then you end up in a role. What we want to do now is try and actually pave the way for nurses and midwives to actually have this as part of their career. So infiltrating within universities for students, making sure that it's in the curriculum, and then the first time you step into a hospital within your inductions, you're exposed to digital and it becomes part of everyday life, and that's what we're sort of trying to strive for. So I would start looking at all the networks that I've put up there, finding out if there's any sort of educational things that you want to get involved in to boost up your career, whether that be a leadership or whether it be digitally specific, and then network.
Thank you very much, Jo. I'm just going to pop to the top of the questions because there's a few come through there. So I've seen one from Elizabeth Dunlop. So many trusts are at the beginning of their digital journeys, moving towards EPRs. What would be your top tips for driving digital engagement for all levels of clinicians, particularly in busy areas? I will start that answer, and then if anyone else wants to jump in, pop your camera on from our panel and you can add. So my organisation has just recently gone through an EPR implementation, and the driving the digital engagement for all levels has to be one of the most important points that you can do on your implementation. So if an area is busy, it's hard to get engagement, but it is vitally important, because if it's busy, it probably means it's a high turnover area, and that is where your patient's being looked after. We did a number of strategies to try and improve that, and we provided a lot of at the elbow support. So instead of removing staff from their clinical areas, we tried to go to them and find pockets of time where we could jump in, whether that was before they did a handover or when they did a ward round. So I think driving digital engagement has to be the top priority for anyone on their digital journey, regardless of the project. Does anyone else want to add anything to that question?
Can I come in there, Emma? Just to say as well, I know you are talking about clinical areas, but also if there's patients involved in those areas, get them involved, get their voice, walk the patch. So, you know, put yourself in that your patient's shoes and walk through the service. If it's a digital app, get involved, get to know that app and see where the clunks are, see where they're going to have issues, and just be prepared to go access what they are going through. If that's helpful. Thanks.
Thank you, Victoria. So I'm just jumping back to the top. So we've got a question. I think I've seen the council on the Rewired agenda. Is it a different presentation? Yes, it is. So the council do try and attend Rewired, and some of us have the opportunity to speak as a keynote next week. So we are presenting a different presentation. It is about the Digital National Shared Decision Making Council, and it's about that collaborative working and how we're doing what we do. So it's a slightly different take to what you've seen today. So if you are going to Rewired, we would love to see you there. And if you see us outside of this of the stage, please come and speak to us so we can share some more work that we're doing. Steph, there's a couple of questions in that chat that I think are pointing towards you there. So Steph, how does what would look like work in primary care? I work in acute and it makes sense, but I'm not sure I get it for primary care. And there's another question there about social care. Is it just for acute nurses? Are you able to respond to that?
Yeah, absolutely not. Primary care is pivotal to the care that we deliver to patients, and as is digital. So there's so much that we can use in primary care to engage our patients, to empower our patients. Coming out of COVID, you know, we've all got massive waiting lists around long-term conditions. So how can we implement things like video group consultations? How can we get patients to sign up to the MyGP app? How can we get patients to use apps that will help them self-manage their conditions out of clinic time? So a lot of it's about physical and mental health being. A lot of it is about self-care and prevention. As an individual practice, it's about achieving our goals within that practice, and how can we start thinking in a smarter way to reach our patient population and share good practice as well with colleagues. I think that's really, really important, and I think digital absolutely lends itself to that on a health and social basis. So yeah, it's, as I said, it's definitely the way forward, and we've not got to be scared about it. We've got to embrace it, and actually it really lends itself to us reaching more patients in our day-to-day practice. So yeah, it's absolutely massive benefits of digital.
Brilliant, thank you, Steph. That was a really nice answer. Kimberly, I'd like to point this one in your direction. So Kimberly, at what point should our clinical staff get involved with digital clinical safety? Are you able to answer that for us?
Yep, so for our clinical staff, we expect them to be involved throughout the entire process of obtaining a product through a supplier, right up until after it's implemented into the trust. Obviously, they're the people that will be using this system to hopefully make their work balance much better, but also they're the ones using it all the time that may come across issues that may have not been thought about at the time of acquiring the product. And this is where things like your in phases and your datexes come in as well, because that always helps us keep an overall view on what it is that you're finding on the floor. If you're having any issues with that product, after rollout, from a CSO point of view, I'm not just there at the very beginning, I'm there throughout the whole life cycle of that product being within the trust. And then the same goes again for before we even roll out a product. We're always making sure that we're talking with our clinical teams, doctors, nurses, AHPs, how that works for them, how they think it will have a benefit on their working time, and making sure that they are aware of what's involved in this project, going from its very baby stages right through to roll out, and then they can obviously come up with any suggestions or any issues that they foresee coming from that.
Thank you, Kimberly. Just want to touch on, so I'm based in the North East. Do you have a regional council? Yes, we do. So currently across England, there are regional councils for every region. So they've all now been established. Some of them were just undertaking their first meetings, but the North East happens to already be established. So Jane Patrickson is your link. But if you do go to the Futures page, you will be able to see all of the regions that have a council and who that link is, so you can contact them. On the next question, we've done that one. So I really like how you've covered all the success measures. I thought what good looks like was for chief nurses, or CNIOs. Can I get involved? I'll start that, and then Joe, I don't know if you want to take over from me. So I'm not a chief nurse and I'm not a CNIO, but what good looks like affects everything that we do and what we do within our organisations. So we looked at the document, and it is essentially for everyone. Your CNIO or your chief nurse may not even know that it exists. So make it your involvement, have a look through it, see where you align as your organisation, perhaps do a bit of a RAG rating. You know, what do you already do? What do you do partially, and what do you not do at all? You know, to get to these success measures, what do we need to do as an organisation to be able to achieve? And then get involved by taking it. Ask for some time with your chief nurse or your CNIO, and let's go through it together. I'm sure they'll be welcoming to go through and see where you're doing really good and where you can make some improvements. Joe, as a CNIO, do you have any advice on how to get everyone involved with what good looks like?
Yeah, no, I think you're right there, Emma. I think I don't know everything. It's my responsibility to sort of take it to the chief nurse once I've kind of looked through it myself, and again, it's about identifying those gaps, so then you know what you need to work on and you know what you need to improve and what the areas you need to improve on. But I don't know everything, and obviously there's a lot of different departments, a lot of different staff within the trust doing their own things. And it's really important for those staff to come to me and to explain exactly where they think they are succeeding really well in certain measures and where they feel they're failing and they need more support. So it's all very well having an overarching view for the trust, but actually we need to understand what's going on the shop floor in those individual areas, and that needs to come up to me to then be able to go to my chief nurse and say, this is exactly what we need to be working on, and these are where we're doing really, really well and we need to celebrate and be proud of.
Thank you very much. Does anyone else want to come in on that, on how we can all get involved with what good looks like before we move on?
Yeah, Emma, Stephanie, I've been on a few digital councils and digital groups and even the CNIO, and when I was first on it, I didn't have digital in my title, and I had that imposter syndrome. But it doesn't matter about our title, it's about the job that we do. And there were some messages, there were some questions in the chat about working in social care, and does, you know, we often feel excluded when we work in social care, but this is absolutely to involve everybody who's involved with any patient contact and care delivery. And if you are in social care, then if there isn't a digital group, then get one started. Join your local one, your regional one, but it is absolutely for any nurse who is involved in the delivery of care, and that's health and social care.
Thank you, Stephanie. I just want to touch upon this question in the chat. So are there courses or skills that can enhance a Band 5 nurse to qualify for a role as a digital nurse? I'll see if anybody else wants to jump in, but I think the point that we need to make here is that all nurses are digital nurses. So it doesn't matter what organisation we work for, what job role we do, there is digital technology that is supporting the patient care that we deliver. And whether that's technology from recording vital signs or doing assessments, we all use digital as part of our job as a nurse, as a midwife, as an AHP. It's just becoming a more and more common thread. You may not have an electronic patient record, but you are using digital technology to support. So I'm sure there are courses out there, and there are different skills and assessments that you can do that looks at like digital literacy, like what Joe was talking about. But essentially, any nurse could qualify as a digital nurse. It's having that interest in how you're delivering your patient care, how you are utilising the technology to support, whether that's improving the decision making or delivering. And I can see Kumbi's put a camera on, so she'll want to jump in a sec. But we do have to remind ourselves that we are all digital in some capacity. And there's no specific course that you need to do to be able to become a digital nurse. It's just good to have a keen interest and understand how we're using the technology to support the care that we're delivering. Kumbi, do you want to jump in?
Yes, please. So I'm a learning disability nurse by background, and as I've said, my current job role is an equality and inclusion project lead. Yet I'm doing, digital health. So I think it's how you think differently. For nurses that are from a Black, Asian or a minority ethnic background, I just want to give a shout out to the Shuri Network. They're a group that are doing great things to promote digital health, particularly with our underserved communities. So they are on Twitter, they do have a website, do follow them. So I just thought this would be a good opportunity to just give them a shout out.
Thank you, Kumbi. Move to Joe.
Sorry, hello. I just that was brilliant, Kumbi. Yes, I missed them when I was doing my networking bit, so that's really good to have them mentioned. I was going to say it is difficult because yes, we are all digital in whatever role we do, but it is still difficult when you don't have a tangible thing to go for a job with. So I do get how frustrating it can be, maybe for Band 5s who want to get into it but don't actually have anything to sort of prove it. Not that we should have to do that. I would say if you can get involved in being a digital ambassador or a digital link nurse, every trust will do something different. It's probably a really good in, because then you'll get the right contacts, and obviously hopefully you'll have a better insight into what the trust is doing with their digital transformation or digital strategy. I would say joining networks, getting the networking going so you can find out what other people have done. Lots of us have been on different courses, and it just contextualizes what we do. It doesn't make us who we are. It sort of helps us define what we are trying to achieve, but it doesn't change what we're trying to achieve. It just sort of really puts together a framework for us to work from. So there are opportunities out there, but unfortunately it is difficult when you're a Band 5 on the ward to be able to sort of jump into these roles. Look out for the digital nurse roles within your trust though. Get involved in a quality improvement project, and this might be doesn't necessarily have to be digital because the same frameworks are the same about making an improvement, but obviously try and bring digital into that if you can. Just some ideas to start you off.
Thank you, Jo. That is really helpful. Victoria, this question is heading to you as a fellow midwife. So how can midwives become more involved in digital within the trusts that we work in?
We're quite lucky in maternity. Every trust should have a digital midwife. And again, I started my journey as a digital midwife. Before that was even a term, I was an IT midwife, and it's just because I got involved. I like to get involved. If something was broken, I wanted to see how to fix it. I was really interested in statistics, and it's come a very long way since then. So reach out. You should have a digital midwife in your trust. If you haven't, you could become that digital midwife in your trust. We work very closely with our CNIO colleagues to make that midwifery and nursing link. So just put yourself out there, ask questions and get involved. The more noise you make, the better you'll find your presence.
Thank you very much. George, there are a couple of questions that I think are coming your way. So there's a couple of questions about being a student. The work you've done sounds great. If we've got students, how can we get them involved? And then there was a second question linking to that about how do you find the time?
So how do I find the time? I don't know how I find the time. I sort of put it out of thin air. But I think if you've got students who are interested, definitely, again, there should be in everyone's trust, there should be digital nurses they can have insight days with, which I found really interesting. Again, if they want to join the regional councils as a student nurse, like get them involved, go on the futures and talk to the trusts and try and get them involved, talk to the CNIO and follow their journey and try to get insights days with them as well. Another one would be to talk to the university as well. A lot of universities have innovation departments and see what if you find a digital solution in your practice or any service improvement, then talk to your universities and see if they can support you with making changes in hospital and in practice as well.
Thank you, George. For the National Council, this year we're trying to do a bit of a refresh, and we're going to actually be posting something about what we think is the minimum requirement. So what we'll be looking for across all regions is student nurse representatives from each region. Because we talk about nurses and midwives, but we do need to include those students because they are our future nurses and midwives throughout our organisations. They will be doing the do, and we're kind of paving the way for them. So if you have students that are involved with your organisation who, you know, they may not necessarily, like Jo said, they may not think that digital is the career path for them, but they may show a particular interest with a digital system or how to use it or see the benefits of how to improve care, then student nurse participation in these councils, both regionally and nationally, is really important. So if you're sat there thinking that you do have a student or a student's come and spent a week, like George has just said, then please do get in contact and we'll see if this is something that they would like to do. And we'll see if we can get them into one of the councils as our future nurses and midwives. Just going to flip back to the top. We've done that one. We've replied to a couple of your questions in the answers. So the Futures platform, Helen's just replied. Jane has very kindly popped her email in the chat for those who were asking about the North East Regional Council. So you can find that in there. Really great to listen to you all today. I have great imposter syndrome and today you've made me feel included. I'd like to explore a career in digital. What are your top tips? So I think Jo might have covered some of this, but does anyone want to give that an answer?
I'm just coming back on that is get involved, get on Twitter, get on LinkedIn, network, go and talk to people, put yourself out there. I have the worst imposter syndrome and I've just started, it was Twitter that did it for me. I got on Twitter and I thought, oh, these are my kind of people. You have the same conversations, it's engaging, it opens you up, you get that passion. So just put yourself out there. If it's uncomfortable, it's a good feeling. That's my top tip.
Thank you very much, Victoria. There's a few more cameras on there, so does anyone else want to jump in?
I just said, just believe in yourself and go follow your passion. Absolutely follow your passion. Follow us on Twitter and you'll see who we're following, which is always that's where I started. And you know, it's the power of the possible, isn't it? If it's as I keep saying, it is the way forward, and you can do it. There's no imposter about it. It's what you do in your, probably in your social life, in your home life. We've just got to translate those skills over now to our professional life and see how many people it can benefit, as well as your colleagues. So absolutely go for it, and contact any of us if you have any issues or worries or any more questions.
Absolutely. Thank you, Stephanie. We've just got a question there, which will take as the last question, and then we'll answer the rest of them later on. So we don't have a CNIO. Is the council a good place to start? The councils absolutely are a good place to start. So if you don't have a CNIO for your organisation, just remember that they're sometimes called different things. So some organisations have CCIOs, some have CIOs, some have all three, some have CPIOs. So just double check what you've got for your organisation, but the national or regional councils are absolutely a good place to start. Even if it's just that conversation starter of, I work in this region and I do this as a job. We don't have a CNIO, so what do I need to do? How do we take it forward? And both us from national and from the regional councils will be more than happy to talk about that with you and give you some guidance if we can. I think we've covered most of the questions there. We've only got 5 minutes left. So any of the questions that we haven't got round to, we will provide an answer, and then in our summary we will post those. But I just wanted to give you a little reminder of the next masterclass. So Masterclass 5 is Empower People, and that is on the 23rd of March, and that's 12 o'clock till 1:15. And that's all about empowering people for improvement and transformation. And I will let you find out on the website who is speaking at that one, but that is the next masterclass that is coming up. So just to end there, we would like to thank you all for joining us today on our masterclass. And I know we've touched upon that imposter syndrome. We were all feeling a little bit nervous about this, but we've really enjoyed it. And we thank you all for joining us and listening to us. I'd like to just give a quick thank you out to our council members who've taken their time today to talk to you in this masterclass session, and we hope you found it informative, and we will answer any other questions in the near future. Thank you all.